We will discuss the treatment options for chronic venous disease. This includes conditions like varicose veins and venous ulcers. The main goals of treatment are to reduce discomfort, swelling, and skin changes. Another goal is to promote healing, especially if ulcers are present. Compression therapy. Compression therapy is one of the most important parts of managing chronic venous disease. It involves using garments or devices that gently squeeze the legs to help blood flow back toward the heart. This prevents fluid from pooling in the lower limbs. Static compression. This is the most common type and includes things like compression stockings or bandages. These are typically used for managing venous insufficiency in the legs. Dynamic compression. Sometimes, patients use devices that apply intermittent pressure, such as pneumatic compression pumps. These are more specialized and used in certain cases. Venous ulcers and compression. For patients with venous ulcers, using compression therapy long-term has been proven to help. If patients follow the therapy plan, healing rates can be as high as 97%. Even people without ulcers but with swelling or skin changes can benefit from compression therapy. Choosing the right therapy. When selecting a type of compression therapy, factors like the severity of the ulcer and pain level play a role. How often dressings need to be changed is also important. The decision also depends on what resources and expertise are available locally. Elastic, multilayer compression. For most patients, using multilayer compression, several layers of bandages or stockings, tends to work better than single-layer options. Studies show that it leads to faster ulcer healing because it provides more consistent pressure. Inelastic compression. Sometimes, inelastic bandages, like an Uniboot, are used, especially in the early stages when swelling is severe. They are also useful when frequent dressing changes are needed. While effective, inelastic compression doesn't heal ulcers as quickly as elastic compression. Elastic versus inelastic compression. Elastic compression, which is more flexible, generally works better than inelastic options for long-term use. It provides higher pressure, which leads to faster healing. Multilayer systems seem to be the most effective. Though these multilayer systems are more expensive and take more skill to apply, they are often more comfortable. This means patients are more likely to stick with the treatment. Compression stockings versus bandages. Compression stockings have some benefits over bandages. They are more convenient, especially since they reduce the number of doctor visits needed. They are also easier to manage during activities like bathing or wearing shoes. However, stockings can get dirty easily if fluid is leaking from the ulcer. Studies show that both stockings and bandages are similarly effective for healing ulcers. Stockings tend to have lower costs and fewer ulcer recurrences in the long term. Some patients don't tolerate stockings well, and they may need to switch to a different treatment if discomfort arises. In one study, healing rates were about the same between those using stockings and those using multi-layer bandages. However, stockings led to fewer recurrences of ulcers after they healed. Conclusion: compression therapy is essential for treating chronic venous disease, especially when ulcers are involved. Elastic, multi-layer compression bandages are usually recommended because they heal ulcers faster. Compression stockings are a good alternative for long-term maintenance. The best choice depends on individual patient needs, comfort, and how well they can stick to the therapy.